We're back. Thank you so much for staying with us. We've been talking with Dr. Brad Ralston about brain balance achievement centers. Dr. Ralston, before we left, we were talking about just the different diagnoses and the wonderful treatments that you guys offer. But now more specifically, I would like to know just how does the program work?
The program is divided into 3 separate phases. A sensory motor phase in which the children work on those soft neurologic signs. They work on gross motor, fine motor, balance, vestibular, proprioception, visual, and auditory skills. So we have a room that's designed to enhance all of those abilities. The other half an hour that they're in with their session, they work with a special ed teacher on neurocognitive training. And this is basically a specially designed curriculum for what we find their deficit to be, and it works on those cognitive skills. The third component is bionutritional. We find that a large number of these children have food sensitivities or reactions to foods that may drive the behaviors that we have. We largely see ADHD as a reaction or a negative symptom to an environmental intolerance, either due to food sensitivities or yeast. And so the bionutritional program is designed to identify any triggering foods and remove them from the diet so that we can regain normal behavior. And then that will allow us to balance the brain in the most effective way.
And that just sounds like a very sound and whole approach to this. What is the length of time for your program?
The length of time that they're in the program is 12 weeks. They come in 3 times a week for 1-hour sessions for a 12-week period.
And in that 12 weeks, what happens? What is the end result?
The end result is that we generally, through our pre and post assessments, can objectively break down data on how well the child did through the program. For example, Dr. Malillo just published a outcome trial of brain balance on children with ADD, ADHD. And he had a sample population of ADHD children go through the brain balance program. After the program, 85% of them went up at least 2 grade levels in the subjects they were weaker in. 60% of those no longer met the criteria for ADD, ADHD. And that study is on our website.
That is very intriguing, especially for just, 12 weeks doesn't seem like a long time.
No, it doesn't.
For a disorder that seems so huge.
Exactly. The results were very impressive. So he's doing more studies on different conditions and different diagnoses.
What research is there, aside from that, which you don't really need much else, but what other research is there to support the brain balance approach?
The brain balance approach is supported through not just research that is oriented around brain balance per se, but just in the field of neurology, there's multiple references that describe functional disconnection syndrome as the underlying cause of autism, ADD, ADHD, and dyslexia. Dr. Malillo authored a book back in 2006 that was called Neurobehavioral Disorders in Children, and the book had 4,000 references in it. So the research is really, to our credit, to Dr. Malillo's credit, lining up to support what he's been saying for the last 10 years. And studies come out, every month, and I'll look at them and I'll see functional disconnection syndrome in there, and email him and say, wow, this is impressive.
Now I have to ask, are these results permanent?
They are permanent. Just like if your child achieves a 5th grade level in reading, it's unlikely that they're going to go backwards to 3rd grade. Now, some of the symptomatology that these children have can vary. As you know, children have good days and children have bad days, and if the environmental triggers that we isolate are reintroduced, or the same stressors are reintroduced, then the problem or the behaviors could come back. But that doesn't necessarily mean the brain imbalance is back. So you want to separate the negative symptoms and the objective imbalance in the brain. Those symptoms can be driven by certain factors. Objectively, we correct the imbalance in the brain.
So how much parental involvement is there with the program?
We do need the parents to be on board with the program because they are integral in the child having success, especially if it's a dietary change that needs to be made, or we need to change the child's activity levels, or there maybe is something going on at home that may be causing a behavioral reaction in the child. So typically when the child comes in to meet with the staff and the coaches, I meet with the parents and we go through the bionutritional and behavioral program in which I do some one-on-one work with them.
So for parents, I'm sure there may be someone watching now who is thinking, wow, this is exactly what I've been looking for. How do they find out more information about it, costs, things of that nature?
Great resources for that. Our website, brainbalancecenters.com. Number 2 is I would grab a copy of Disconnected Kids. I think it's a great book for parents to gain an understanding about their child's behavior. And number 3, we offer bi-monthly parent lectures that are at our office, and you can find out information for that. They're free of charge. You can call us at 843-9200 and we'll get you enrolled for one of those, and you'll get a free book if you come.
Wonderful. And you said how often are the lectures?
We have them every 2 weeks.
Okay. And where are the lectures located?
Our office is going to be basically in the 9300 area, 9300 North Meridian, in the new Paradise building, right there at 93rd and Meridian. So we're moving into that suite July 12th, and but our office is where we typically hold the lectures.
Wonderful. You know, with this type of program, is it government funded? Is there any way that parents can get assistance in enrolling their child? Does health insurance cover it? How does that work?
Because it's supplementary education, it is not covered by insurance. We actually don't refer the program as treatment. It's more achievement or an achievement-based program because it's learning-based. Insurance companies oftentimes exclude physical treatment of ADD, ADHD and classify it as experimental. However, some insurance plans, if you say, for example, have an HSA, some HSAs have supplementary education benefits in there, and you can submit to your HSA, and that's a possibility. Other than that, we also have ways to create financial arrangements for the parents, different payment plans for them.
Great. We only have a few minutes left, but would you mind maybe just sharing a story of a success story of something that you've seen, a turnaround? I'm sure you've probably seen several, but in a particular child. Yeah,
we have several that have been through our program. Just to give you some background, I trained with Dr. Malillo in 2001, and so I've been treating kids with these disorders for 10 years here in Indianapolis. So the kids that I've seen haven't really been through brain balance yet because we haven't opened as brain balance, but just working with these kids and being a part of changing their life is something that is the most rewarding thing you can ever imagine. I have a family history of these problems and can see how they can affect a family. And so, I just feel like these kids are in a really important stage, and that this can really swing the pendulum on how their future is going to be. One child in particular is Robert, who had Asperger's syndrome, and Asperger's is a high-functioning autistic disorder that affects social emotional function. He was very slow. He was a perfectionist, but very quiet, never really spoke in class and never really gave his opinion. These kids tend to be highly intelligent and seem to gravitate towards math and science and computer type of interests. He just really excelled in our program. His mom couldn't say enough about what he was doing. He instantly, the teachers asked her, you know, what are you doing different? They noticed an immediate difference with him. He went up in all the categories, but really he thrived socially coming through the program. And his parents put him through the 12 weeks, got done, signed him up for another 12 weeks. They said, we just want to keep going. And that's a very a good testimony for our program, is when the parents say, we don't want to stop. Right. We just want to keep going because we think there's more that you can do for our child. But Robert is one that definitely always remember.
Well, you know, obviously the work you're doing is just so helpful and positive, and just a wonderful thing for us to have at our fingertips. I'm so grateful to you for what you're doing, and I hope that something was said today that can help you if you know of a child who's struggling with some of these difficulties, or if you're just wondering if this could be a problem for your child. Please don't hesitate to contact someone from Brain Balance Achievement Center. Thank you for tuning in tonight. I hope you tune in again next week.